An outbreak of Ebola tops 700 deaths now in West Africa. Today, the World Health Organization announced a plan to help those hardest hit. Canada also issued a travel health notice for 3 African countries, while the United States went even further, warning its citizens not to travel to Liberia, Guinea, and Sierra Leone. The CBC's Kim Brunhuber has the latest.
A state of emergency in Sierra Leone. Security forces have been called in to help quarantine Ebola victims and defend aid workers from attacks. For weeks, they've been asking for outside help. Too many sick people for the overrun healthcare centers to handle. Too few workers to track down those who are still out there.
The situation is quite difficult. I would say we are on the top of the iceberg in the moment.
In Liberia today, a desperate appeal for international aid.
Our government has declared this now as a humanitarian crisis that is above the control of the national government.
Now, the World Health Organization says it's sending more help. It announced a $100 million U.S. response plan and is calling for several hundred doctors, nurses, and other experts.
CDC, along with others, are surging to begin to turn the tide.
The American Centers for Disease Control announced it will send 50 more people to set up clinics, screening, and training to help contain the outbreak.
It's not going to be quick. It's not going to be easy. There is no proven treatment. There is no proven vaccine. So we're not going to treat or vaccinate our way out of these outbreaks.
There are experimental vaccines out there, but none have been approved. However, what's being called an experimental serum was sent to 2 infected American aid workers. There was only 1 dose. According to the organization for which they were working, Dr. Ken Brantley asked that it be given to his colleague. The 2 Americans will now be transferred to the U.S. by medevac, the first time someone with Ebola will be treated in America. For stricken West Africans, no vaccine, no evacuation. Experts say best-case scenario, containing an outbreak like this would take 3 to 6 months. But they acknowledge, with threadbare healthcare facilities and attacks on those who are trying to help, the scenario they're facing couldn't be much worse. Kim Brunhuber, CBC News, Toronto.